speakers.
Good afternoon.
I request ma'am to start today's session.
Thank you, Dr. Neha. Thank you, everyone. And very good afternoon to everyone. I hope you all are able to see my screen.
Yes, absolutely.
Okay. So today's presentation is going to be on workplace-based assessment. And the learning objectives for this session are going to be, we'll be describing the key features of workplace-based assessment. We'll discuss the different levels of competence of an undergraduate student. We will assess the role of assessment in competency-based education. We'll look at what are the main components of workplace-based assessment. We'll go on to feedback and see what is the role of feedback in learning and how workplace-based assessment incorporates feedback into the learning circle. We'll talk about some do's and don'ts of effective feedback, and then we'll go on to the tools for workplace-based assessment, where I'll be listing out the tools and I will cover DOPS, and the rest of the tools will be covered by Dr. Anushi. So by now, I'm sure we all know that workplace-based assessment corresponds to the highest level of Miller's pyramid, which is the DOES level. And by the time the undergraduate student reaches this level, already his performance is integrated into routine practice. And along with the cognition, there is already a change in behavior, which allows the student to practice in the clinical area on actual patients. So when we talk about the features or key features of workplace-based assessment, let's look at what are the key features of workplace-based assessment. This assessment needs to happen at the actual workplace. That is, if the students are posted in the clinical area, they need to be actually working in the clinics on actual patients. It involves direct observation of the students while they are working on patients. And very importantly, it makes use of feedback as a tool to improve learning. So feedback is a very, very important component of learning in workplace-based assessment. And workplace-based assessment can be used to assess a wide variety of skills, which include history taking, which include examination, communication skills with the patient, showing empathetic behavior, professionalism, teamwork, collaboration, as well as your procedural skills. So when a student joins an undergraduate program, let us see how his level of competence increases over a period of time with training. So as a student, comes to the dental college or a medical college, in the first year, the student is at the level of novice. Novice is just a new student who does not know what he's supposed to do, what he's supposed to learn. So with increase in knowledge, by the end of, let's say, first or second year, the student is at the level of an advanced beginner. By the time the student comes to the final year, in final year, he is in dentistry especially. In the final year, by the end of final year, the student is supposed to be at the level of being competent. So as the student, clears his final year, completes his internship, he should be above the level of competent because he should be able to manage basic procedures, basic diagnosis, basic treatment planning by himself. And the next two levels of being proficient and master are attained much later after the graduation. Maybe proficiency level is attained by the time the student completes his master's or is in his, second or third year of the MDS. And expert level usually is attained much later. By the time you are already 5 to 10 years in your practice, that is the time when you would become an expert of your science. So this is just to show you how the level of competence of an undergraduate student progressive over time and with practice and with experience. So this is again a graphical representation to show you how the competence, develops in undergraduate student and how it is related to the consciousness of the student. When the student is a novice or a first year student, the student is at this level, that is the first level, unconscious incompetence. The student is not aware as to what he is supposed to know and what he does not know. The student doesn't know anything. So by the time student finishes his first year or comes to the second year, he realizes that what he is supposed to know and what he does not know. So he moves from the level of unconscious incompetence to the level of conscious incompetence. So he consciously realizes what is his incompetence, where his incompetence lies, and what are the efforts that need to be made to improve it. So, as the student practices more and learns more and develops his skill further, he comes to the level of conscious competence. Conscious competence when he is consciously applying the skills that he has learned to put into practice. So, he is consciously becoming competent. He's practicing. And by the time student finishes or is in, has done his post graduation, the change in the knowledge has already translated into the change in his behavior and change in his practice. So the competence that he has achieved, it goes at an unconscious level without even realizing he is being competent. He is able to perform and he is able to manage his patients. So that is the level of unconscious competence. So why I'm showing you this graph is that with our regular assessments, we need to take the student through all these stages from unconscious incompetence to at least up to the level of conscious competence at the end of the undergraduate program. Now, what is the role of assessment in competency-based education? Can anybody, share your thoughts? What is going to be the role of assessment in competency-based education? You can put your answers in the chat box. What is going to be the role of assessment in competency-based education? What do you feel? And how is it going to be different from the conventional curriculum? Evaluation of competence of student in practical procedures and knowledge, how this evaluation is going to be different from what we are already doing in the conventional curriculum. Time bound. Any other thoughts? Evaluation criteria based on formative assessments over duration of course, yes. To assess the level of competence as well as the stage, right? Also to assess the effectiveness of teaching methods and developing actual competence and beyond just knowledge, right? Will help to understand what skills the need. Yes, students need to work finally. Okay, very good. So many of you have a fair idea about how the assessment is going to change with competency-based education. So Competency-based education is basically, deriving an evidence of whether the student has attained the competencies which are desired for the undergraduate level. So that means with every assessment, we need to generate evidence of the level of competence of the student. As I think Dr. Deval already mentioned that, we need to know at which level the student is right now. So assessment is very deeply embedded in competency based education and is going to be a very big focus of competency based education. At each level, we will need to generate evidence of what is the level of the competence of student and how we can improve it further. Feedback is going to help in that. So when we look at the role of assessment in competency based education, so it calls for a continuous and frequent assessment. So assessment needs to be a continuous part of your teaching in competency-based education. It should be criteria-based rather than norm reference. So no use of percentiles. We need to have predetermined set criteria upon which we will be assessing, or we should be assessing the students. It should assess what the learner can do in the actual work environment. So that means we need to generate the evidence of the competence of the student, and that can happen in the actual workplace environment. Should provide opportunities for improvement of skills, and a good assessment should always help in improving the skills further, should always help the student to improve his competence to go from one level to the next level. So when we talk about the assessment of what the learner can do in the actual environment and providing opportunities for improvement of his skills, that brings us to the two most important components of workplace-based assessment. First, it has to be based on direct observation. If it is based on direct observation, only then can you give the evidence of what the student can actually do in his work environment. And secondly, if you need to give him a chance to improve his learning, to improve his skill, feedback plays a very important role in improving the competence and the skills of your students. So as already I showed this picture yesterday also, assessment is the engine which drives student learning. So if we want to modulate student learning, we need to change our assessment. And feedback is very important to improve the effectiveness of assessment and to improve the learning, because feedback is the oil which will lubricate the engine of the assessment. So when you want to give feedback, or while giving the feedback, what are some of the important things that we need to bear in mind? And when we talk about feedback, what is the role of feedback in assessment or in learning? Feedback allows the trainee to reflect on his or her level of performance. So with the feedback, the students can reflect on how he has performed, what he has done well, what are his areas of strengths, and what are the weaknesses that he still needs to work on. In the conventional curriculum, when we assess the students and on a routine basis, we do not have an environment of student reflection. We don't encourage our students to reflect on their own performance. So in competency-based education, reflection is going to be an important aspect of the assessment and learning. So I always feel that reflection is the first step of corrective action. Okay, so assessment should allow and feedback should allow the student to reflect on his or her own performance. Student should be able to identify what he has done well, what are his strengths, what are his areas of weakness, and then also suggest how he can overcome those areas of weakness. For the faculty, the feedback gives an opportunity to give constructive suggestions for the student to further improve his skills, to further improve his competence levels. It allows the trainees to identify their learning needs. So when feedback is given regularly over a period of time, so the student can identify his improvement over the time, and then he can also isolate what are his learning needs. With every feedback he will realize, okay, this is something that I am able to do, and this is something that I am not able to do, and how I can further modify it, or how I can improve upon it. It also helps to identify the challenges which the student might be facing and what support the student needs from the faculty. This is very, very important for learning. So, while giving feedback, some of the do's and don'ts that we need to keep in mind while giving feedback. The do's are that the feedback should be, soon after the observation, or as close as possible after the observation. Now, why is this important? For example, you have observed the student in a clinical setup while working on a patient, and let's say while doing a direct observation of procedural skills. So, immediately after the observation, the student is fresh about how he was able to perform his procedure. He will remember all the details correctly. The faculty also knows all the details about how the procedure went, what were the shortcomings, what were the areas of strengths correctly. So the feedback will be more valid and more precise if it is given immediately or soon after the observation. Feedback should always be, it should always describe very specific behavior. Do not give vague feedback, because vague feedback, the student will not know what he's supposed to improve and how he's supposed to improve. You can always give examples like, I could see that you were able to do this well, and I observed that you were fumbling in this area. So make it very specific for the student so that he's able to identify his areas of weaknesses. Only comment on what you see. This is this is a method of making the feedback more objective. Do not include any extra information in your feedback, anything about his appearance, about where you saw the student 2 days back in the market. So it should only be very specific on the observable behavior. Give examples of what was good and why it was good. That helps the student to build confidence on his strengths. Suggest alternatives to areas needing improvement. So if you're telling the student, if you're able to identify a student's area of weakness, you could always give suggestions of how he can improve it or what he should do to improve it. If you feel that the student is lacking in the knowledge field, we can always ask the student to refer some texts or refer some books. If you feel that the student is fumbling with the practical aspect of the skill, we can ask the student that this is how you need to practice more, or you practice more on the on the models before you do the next patient. So always suggest alternatives to areas needing improvement, and always devise a plan, a follow-up plan or a follow-up action of how the student is going to work upon his weaknesses, and what exactly is the student going to do, and when would the student come back to get his skills reassessed. If we look at some of the don'ts are avoiding any inappropriate place or time. Very important to give feedback in an isolated, in a close space where the student is not around the patient or his peers, and in a non-threatening environment. So usually we avoid giving the feedback in front of the patient or in front of the student peers. We always call the student in our office, make him sit comfortably, and then we give feedback. And the feedback, again, as I previously said, it should be objective. It should be on the observable behavior or observable skills of the patient. We do not judge the student as a person. We do not make any general comments. Avoid making any general comments about the student. Do not break confidentiality. So, again, not to discuss the feedback about the student with other faculty members, and the information should be kept confidential, and do not be vague. So, the feedback should be objective, it should be specific, it should be clear to the student. Again, with every assessment and with every session of feedback, this shows how the student moves from the different levels of competence. Sorry. So always we start with the making the student reflect on his or her own performance. So the first question is usually, what do you think you did well? What went well? So that prompts the student to make a conscious attempt to think that what was his level of competence, what were the things that he could manage well, what are his strong points. Then we go to the level of unconscious competence. That means some things that the student is already doing well, but he is not realizing. So the faculty can, supplement the student's reflection by adding that, okay, you think you did this well. Well, I think that this was also an area where you were able to perform without any problem and you could manage this. Then we ask the student, where do you think you need to improve? So the student consciously makes an attempt to identify his incompetencies. So the student might say that, I was fumbling in this particular area, or I was not very, for example, I was not very comfortable in identifying the instruments or whatever. And after that, the faculty also takes him to the level of unconscious incompetence, something that he was not able to do but he's not realizing it. So although you think that you were not able to do this or you need to improve that, I feel that this is also one of the areas where you need to work on. We try to avoid statements like that this is your weakness, or we always say that this is the area for improvement. So we always end, make the statement or keep the statement on a positive note. So going on to the tools for workplace-based assessment, we have a variety of tools available for workplace-based assessment. Commonly used tools are your direct observation of procedural skills. We have your mini clinical evaluation exercise, what we call as mini CEX, clinical encounter cards, case-based discussions, which are discussions or detailed cards about cases that they have seen or they have worked on. We have multi-source feedback or 360-degree feedback, and we have portfolios and logbooks. All these are your tools of workplace-based assessment. So from here we go on to the direct observation of procedural skills. This is in direct observation of procedural skill. Usually an assessor observes the student directly while performing a routine procedure on a real patient in a real situation, and the performance is assessed on a structured checklist. An immediate corrective feedback is given to the student. Again, as I already pointed out, like many other workplace-based assessment tools, DOPS can help in assessing diverse range of skills, right from your clinical examination skills to your procedural skills to your patient education skills, time management, organizational skills. Multitude of skills can be assessed using direct observation of procedural skills. So this is just to show you a sample, assessment sheet or checklist of direct observation of procedural skill. This checklist we have developed in our own Department of Periodontology, and we've been using it to, assess the scaling skills of the students. And we have divided the entire procedure into different parts. The first part is the student demonstrates adequate knowledge of anatomy, the indications, and the technique of the procedure. Second is the student obtains informed consent after explaining the procedure and its possible complications, carries out the procedure in an aseptic manner, demonstrates the correct use of the instruments. The student has time management skills. That means he can complete the procedure in a stipulated amount of time. He can communicate important findings to the patient at the end of the procedure, shows empathy, and consideration for the procedure. So we have divided the entire procedure into different components, and we are assessing the student on a scale of 1 to 10. So we have already predefined criteria as to what is below expectation level and what are the marks we are going to award for that level. What is borderline performance? How are we going to define it? And what are the marks awarded for borderline performance? What is the expected level of performance and the marks? And what do we consider as the above expectation level? So I would just like to tell you that the assessment of the student and what is expected level for the student will differ according to the different stage of the student. For example, if you're using this DOPS checklist to assess a third year student who has just started scaling on the patients, the expected level of performance for a third year student would be different as compared to the expected level of performance by a final year student. Okay, so we need to be very clear about what is the expectation level corresponding to the stage at which your patient is. And secondly, the DOPS is supposed to be evaluating the entire procedure right from the beginning to the end. So selection of the procedures for DOPS is very, very critical. We have faced this problem when we were doing DOPS for for my FAMA fellowship, that we wanted to do DOPS for scaling, but we realized that the student usually does scaling on a patient over 2 to 3 sittings, and it was not possible to assess the entire procedure in one DOPS. So what we did was, in whenever we were conducting DOPS on a student, we would assign them one particular area, and we would just observe the student work on that area from the beginning till the end. So we would tell the student that today you will be only working on this area for this assessment. So that made the assessment more feasible. So selection of the procedures is going to be critical for your DOPS assessment. And again, for your workplace-based assessments to be effective, to help in student learning, it is written in, I mean, there is evidence in the literature that we need at least 4 to 6 assessments for the assessment to be effective and for it to bring about a change in the level of student competence. So we need to plan out when to do your DOPS, okay, or when to do your workplace based assessment. So if you see at the end of the table, there is a column for reflection by the student. So while the student is working on a patient, the faculty fills the upper columns according to his performance. But at the time of giving feedback, we always ask the student to first reflect on his performance. So student put down his reflections in the reflection column, and then the assessor discusses with the student how he or she thinks his performance was. And there is a space for the assessor comments. And I could not include because the form was bigger. Below this, there is also a space for action plan for the future, where the student and the faculty, they come to a consensus as to how the student is going to improve or work on the areas which need more improvement, and what are the specific actions that are to be taken. So we always end the feedback with a solid action plan. And a copy of this assessment is usually given to the student, and another copy of this assessment sheet is kept in the faculty's file, where it is kept for the record purpose. This is another example of a generic DOPS checklist which can be used, where you can again see different columns and different rows indicating what all areas you are going to assess and what are the levels of performance. Sometimes it may not be possible to assess all the columns in one assessment. So for example, if I'm doing a DOPS for a third year student, I may not be able to assess his time management skills because the student is just starting out. So I can leave that part out, or I can cross that out. So if any of the aspects of the procedure or any particular skill you are not observing at that encounter, you can always cross it out, or you can you can mark it as not assessed. So we will now proceed to show you the video of the DOPS, and then we can take any questions or thoughts.
Dr. Neha, audio is not there. Dr. Ritu Jain, madam.
Yeah, sir, actually, we are having an issue with the audio, because when we are playing it here, the audio is okay.
Okay.
Zoom, I think there is some lag that we're just trying to replay it.
Yeah. No problem.
कुछ नहीं कर सकते। क्या रहा मैसेज? नहीं लिखा है। एक सेकेंड, नहीं वीडियो चलाया है, उसका ऑडियो नहीं आ रहा है इतना अच्छे से, कम आ रहा है। शेयर किया हुआ स्क्रीन पे। हाँ, ये प्रॉब्लम थी। हाँ प्लीज आस्क। नहीं पर यहाँ पे आ रहा है, वहां से कर लो, वहां पे भी हुआ है इससे।
अपना नाम मत लिख, लिख लिख लिख।
कैसे कर सकते हैं? कास्ट की है मैंने यहाँ से कर रही हूँ। तभी HDMI लगा दो प्लीज, लगा दो जल्दी। ये बात तो पता नहीं थी ना, कैसे होगा ये? वो निकल गया, कोई बात नहीं, करो। कहाँ लगाऊं? इसमें पोर्ट होगा मैम साइड पे HDMI का। हाँ जी मैम, उसमें मैम। नहीं उल्टा। अच्छा देखना प्लीज, ये करना। हाँ जी मैम, दे दो मेरे को। होता तो नहीं है। हाँ। अब आएगी बोल। रिपीट इट सर। इन केस यू नीड टू रिड्यूस इट। एक मिनट, मैं फिर से वीडियो पूरा करूं? मैम स्पीकर सकते हैं।
बड़ा वाला तो जो माइक है ना, इसमें से आई थिंक वो आवाज नहीं कैच कर रहा है
अच्छा इसमें से आवाज नहीं कैच कर रहा है?
शायद, क्योंकि यहाँ पे हमें आ रही है पर उनको नहीं आ रही आवाज।
नहीं लिखा है। Yes, still but not clear.
स्टिल नॉट।
इतना तो होएगा।
पहले भी अगर आ जाए ना, देखते हैं।
वीडियो क्या है?
स्क्रीन शेयर भी किया। शेयर मुझे तो दिखा।
ना बस, हाँ बस कुछ।
It's better to play the video in mute and the background you can narrate. Yeah.
ये सब तो आई कांट नरेट।
नहीं, I can narrate अगर आप फिर वीडियो म्यूट पे कर देते हैं।
नहीं पर मिनी CX पे भी क्या नरेट करोगे सारा?
उसमें नरेट हम यही कर सकते हैं कि क्या हो रहा है। वीडियो कम्युनिटी कर
मैं स्टॉप शेयरिंग करना पड़ेगा, मेरा तो वीडियो ही नहीं दिख रहा मुझे। रहने दो यार, जितना समझ आ रहा है इनको। रूम का प्रॉब्लम तो रहेगा ही।
इनको मैं पूछ रहा था बाइक के रिगार्डिंग, शायद बाइक हो जाएगा अरेंज।
नहीं, वो तो अब चल रहा है ना ऑलरेडी। उसका क्या करूं मैं? ये देखो, सेम है सिस्टम करूं कि स्पीकर?
Select the speakers. No, speakers memory alert है। इसे फिर
नहीं लगे।
बाकी काम बंद करें। ओके मम्मी, सारी ठीक है।
ओके मैम, आ रही हूँ।
click on it to see the video and discuss it.
स्पीकर्स पक्का मतलब यही आ रहे? स्पीकर्स यही आएंगे?
मैम दोबारा ये था, मैं थिंक वो सेम ही था, जो सेम है सिस्टम। ये तो मोड्स है ना, सिलेक्ट द स्पीकर, सेम है सिस्टम।
चलो मैं इनको डिस्कस कर लेती हूँ
मैं एक बार ये बता देती हूँ, ये वाला वीडियो का पार्ट। एक मिनट, वीडियो का पार्ट बता देती हूँ। Okay, sorry for the technical glitch. So in the video, the student was given lower anterior quadrant for scaling, and the assessor was standing on the side and assessing the student without saying anything. After that, the student was called in the assessor's chamber where feedback was given. This kind of feedback is modified pedantial method, where first of all we ask what went well. Dr. Ritu had shared the DOPS sheet with you. So what went well, the student will tell you what all was right. Then where were the areas of improvement, what could have been better, and then you give your feedback. Once you give your feedback, both the assessor as well as the student, they come to a action plan, and which is shared and discussed and agreed upon by both the student and the facilitator. And then the facilitator also would give suggestions as to how it could be improved. The fourth part of the feedback is areas where action plan and areas of improvement. So this is basically a developmental feedback. And in the end, the student and the faculty both summarize what all happened and how it could be improved. Over to Dr. Ritu.
Yes. So apologies for lack of voice in the audio. So you were able to maybe have a broad idea about how the dogs was conducted. Can I have your thoughts, or your what do you think,
Screen sharing से हो सकती
or any questions that are coming to your mind?
है वीडियो की
If you have any questions, you can raise your hand, and then we can
ये तो नहीं चाहिए
talk.
बस एक ही वीडियो की आवाज आएगी इसमें भी क्या है
If you don't have any questions, I would just like to ask you, how many of you have had an experience of using DOPS in your departments for undergraduate training? No, we usually, Bharati, we do not prefer having the same assessor for all students, because the same, we want, every time a different assessor, so that the assessment is more objective. There are less chances of bias in this kind of assessment, because we already have predetermined criteria. As we said, that the assessment sheet or the checklist should be criteria based, should not be norm referenced. So having a different assessor every time or for every encounter is preferred over having the same assessor. Anybody who has used DOPS in their departments for student assessment?
We are using for postgraduate assessment.
Okay, Dr. Nilima. So what has been your experience for of using DOPS for the postgraduate students? How feasible it has been for you?
So it is like for the procedures which are of 15 to 20 minutes.
Yeah.
For that we used to I had done this for, suppose for example, indirect pulp capping or extraction. I mean, in that all the procedure right from like giving LA until post-operative instructions giving to the
Yes.
patient, and handling of the instruments. And then most of the time what students do, they, for writing notes also, they use the gloved hand. So there we can guide them that I mean, it is like feedback to particular student that not to do like this, don't repeat this next time.
Yeah. So how do you think you can use it for undergraduate training?
So I have not used, ma'am, that's why That is, I did not come across such experience actually.
Because usually in post-graduation, we have few students and they are with us for a longer period of time. So we have ample opportunities to actually observe the student in the workplace. So in undergraduate, most of the institutions, the challenge is that more number of students and less number of faculty. So we will have to devise ways of how to adapt DOPS for our clinical assessment, and maybe it may be initially it may be possible or it may be feasible to do it as a part of formative assessment as an end posting test when you have smaller or lesser number of students in the posting. And you can, even if you have postgraduates in your department, you can train the postgraduates in observation skills and giving feedback, and you can use PG students as observers or assessors for your undergraduate students.
Yes, ma'am.
Thank you. Anybody else would like to share their experiences or any other challenges that you can perceive? Okay, so no questions from your side. Just wanted to make a point that these assessments, the workplace-based assessments, are usually student-led or student-initiated. It is the student who comes and asks to get assessed. But in our experience, what we've seen is that when we did it in our department, because our students were not used to it, so they were scared or they were hesitant in coming and asking us to do a DOPS assessment. So we had to encourage them to get the assessment done. But once they realized that it was actually helping them, then after some time they were more forthcoming in asking for an assessment. So initially, there may be some reservations on the parts of students, but when they realize that it is going to help them, they will be more forthcoming. So now we move on to the next part, which will be taken by Dr. Dinesh.
So very good afternoon to all of you. आप अपना ऑडियो लीव कंप्यूटर ऑडियो कर देना दोनों types. So very good afternoon to you. Now what we will discuss is about the internal assessment, which I think most of you deal throughout the year. And for decades we have been debating a lot on the utility of the internal assessment. So we'll go into nitty-gritties of internal assessment, taking few examples also. रितु को कुछ हो रितु आ रहा अभी वीडियो
आपका यार
आ रहा है आपके पास ओके मेरे पास रितु का
वो तो बंद
कोई आप नहीं करता अभी मैं ये करता हूँ फिर देखता हूँ शायद बंद हो जाए। मेरे पास वही आ रहा है So we start with the components of internal assessments and some of the regulations which are there. Since now you know very well that your curriculum is also moving towards competency-based education. So what the major change will be there as compared to the traditional curriculum, that assessment will change largely to formative. When we say formative, it means part of this is internal assessment. So a lot will be handled by you versus the university examination, which happens in the traditional exam. I'm giving you a few examples here. Some part of the formative, which we use formally to calculate the marks, the percentages, that becomes the internal assessment. So there will be many tests. These will be low stakes marks. So even a student is not performing, he's as an off day, or there's a health things and all, even that is taken care of that versus summative assessment where they are high stakes exams. Even one exam is goes wrong, there's a problem. So that basic distinction we start with. Summative is at the end of the course, like 1 year. Formative is throughout the year, and part of the formative which we use to calculate the marks for internal, that becomes the internal assessment. So as you know, in the BDS, there are two criteria as of now. One is marks, 50% marks are needed in internal assessment. Another is attendance, 75% attendance. Now, when we look at these criteria and when look at the university exam for which these internal assessment is eligibility criteria. So when we look at that in the 2015, Supreme Court has given a ruling that internal assessment marks cannot be used for pass-fail decision. It means they can be used only to calculate the eligibility for the university examinations. On the day of university examination, if you look at these component, I will require you to now put your responses in the chat. University examinations, when you test knowledge, you assess presentation skills, communication or practical. Out of these four, which are the skills which you think are presently in our university exam, we focus more on that. You can keep on typing in the out of these, which one you think we mostly assess during the university exams.
ಹಿಂಗೆ ಪೆರಿಯೋದೆಲ್ಲ ಯಾಕೆ ನಮಗ್ ತೋರಿಸ್ತಾ ಇದಾರೆ ಅರ್ಥ ಆಗಲ್ಲ ಪೀಡ ಪೆರಿಯೋದು ಡಿಫ್ರೆಂಟ್ ಆಗಲ್ವಾ
Okay. Please keep on typing. Just we can see skills, communication skills, knowledge is coming a lot. One practical skill has come. Memory, right? Practical skills, right? Keep on responding. We can look at your responses. Okay, practical clinical exam for the practical skills, presentation skills, definitely. Knowledge. Okay, knowledge, but actually they reflect as you have written, students' communication and presentation skills. Okay. So what we see, majority of you are writing that we assess mainly the knowledge, which you see here. And mostly that is coming a lot. And after that, there's some thoughts also, okay, maybe knowledge or it is a presentation skills on that day we are looking at. Okay, some few has come in a practical skill and very few for the communication skills. But remember, we are looking at a lot of these things. But mostly they are concentrated or focus on knowledge or maybe on the presentation skills. As compared to that, when we look at other components,
So mentoring should not mean only one thing.
other components,
Training of the mentee who you got to maybe help them in the.
so you send a student to examine the student, you ask them to lower the volume. So you send a student to examine somebody on the day of BDS exam, but ultimately you are not observing them. You are asking them to come back and again sort of tell how they have done the examinations. So it is mainly focused on presentation or the knowledge. So multiple vivas can be there. Versus, so you can see we have many examiners during all years which examine these students. On the internal assessment side, which is throughout the year, see how many of these we can now again, can you now responding that we can actually look at many components in the internal assessment period, like knowledge, practical skills, communication, regularity, participation in learning, interpersonal skills, academic honesty, ICMR projects, attendance, and many more. And what do you think that when the students are with you for 1 year, which of these skills you can actually assess? Now, we are not talking about the university exam where you have already told us, okay, there's limitations. But on the other side, when the students are with you for 1 year, which of these skills or which are these components you can assess more? The list which is on your computer on the right side. You can continue to respond to that. Let's see whether the list seems similar or there changes also. You can type in the chat. Any one of you want to speak, we can also unmute you. That is possible. Okay, now list is becoming longer. As we see, you have added many things, academic honesty, ICMR projects, many BDS students are doing. Attendance also, we can see their participation in learning, okay? How they learn, the process, not just the end result. Okay, all the lists, all the things on the list which are there, yes. I agree with Dr. Bharati. And the participation in learning is very important. Otherwise, we are not able to see the course, how they have learned throughout 1 year. We just know the end result, what is their learning on that particular day. So that keeps on happening when we look. It means when we put titles to these two columns, one is assessment of learning, which happens on the day of university exam. But when we look at the internal assessment, it is assessment for learning. Means when you students are with you for all these components, throughout this, we can talk to them. We can see how they are participating in learning. As you said, ICMA projects, we can guide them. So continuously, even we use here assessment for learning. So that provides us something which is the purpose of internal assessment, that we use it for their formative components. We improve their learning. So coming to the basic, you can say one of the principles in learning, that assessment drives learning. If your internal assessment is strong, it will encourage students to read more, learn more. And also you can see number of opportunities are much more as compared to university exams. So what we are actually looking at, this learning which happens through this, when they ascend this pyramid, ascending the pyramid is taken as the process of learning, how they assess from simply knows, they go to understand that, and then they perform some procedure, dental procedure, and we are able to observe them. So this is something, how they climb this pyramid, we can see due with the internal assessment. And it is reported that or documented and recommended we should use multiple methods, multiple examiners in multiple settings. to assess multiple competencies. For that, we should use blueprinting and longitudinal assessment to improve the validity and reliability of the assessment. So internal assessment gives us a lot of flexibility and scope to do experiment with all the principles of assessment. Recommended are that we should do day-to-day assessment, how they behave, how they perform. Also, regular periodic exams are part of that. If you are doing seminars for the BDS, that clinical case presentations, problem solving exercises, projects, ICMR, non-ICMR, MCQs you are giving at the end of the class, you can keep on noting. Every time you don't have to give marks. Sometimes it is subjective assessment, which has a more value. Words also has a more values in the assessment. So theory, for the theory internal assessment, theory test, send up pre-university exams, term and exams, quizzes, interest in subject, scientific attitude, which can be marked by all the teachers at the end of the course. Written test have short notes and also have multiple components. Practical means practical clinical test, OSCE, OSPE if you are doing that, DOPS, mini CX, all those components can be taken into account. And since now logbooks, many people are using, if you're using logbooks, you can frame that and use them for that. Reflection writing, logbooks, they show to every month. You can read what they're going through, give your components, even some grading can be done. So that is part of that. And a lot of studies we have done related to that. Okay, especially just not being judgmental, but just self-assessment of the students during internal assessment. And we are using for last 15 years one format in internal assessment, which your university has adopted. Many colleges are using that. How to do this internal assessment part. This is the format which we are using in the MBBS. The upper part is theory assessment. The lower part is practical assessment. And weightage is given to the marks 80%. 10% goes to logbook. 10% goes to subjective assessment by each teacher. Interest in subject, active participation, scientific attitude. Okay, so those things are important. Our marks are only these here. And similarly, we are looking at professionalism, ethics, communication in the practical part. Similarly, for the BDS students, I'm taking the actual sheet from the BDS. As I told you in the university for BDS also, we are using internal assessment format. So here is a student's performance throughout 1 year. These are the marks which are there. We have different theory marks. These are the marks given by teacher 1, teacher 2, teacher 3, 4 for the interest in subject and other things. 3 monthly, they sign on their attendance and the percentages. In the end, we calculate their internal assessment and the student will sign, the teacher required, the HOD will sign there. This way, we keep on showing this to them. After 3 months, they sign. They also know where they are. We also know if they need some remediation. So this way, this goes on to that. And this is a full book which we bind, and for each batch, each department gets it. And I'm not sure if you're able to see it. Mishi, you can see it. Okay. So this is the book. Okay. One side will have a student's particulars also, parents information, and then this whole book in the book form of book is given. So you have one page for each student throughout 1 year full performance you have here, each subject. And they also know that this is being done by all departments. And then we correlated with this, with some of the concept, if you remember from day one, when we started on 6th May, about principles of assessment, validity, other components. So we did studies on that to see whether this internal assessment correlates with the final university exams. And we found good correlation with that. Remember, assessment becomes authentic if people are honest and integrity is maintained at all levels. Then you are able to do. And why we are doing this? So that we can provide feedback. See, our system is like we have an input and there's a learning happens, which is a process, and there's the output, which we look at the form of the university exams. In between, we are giving them feedback to improve this process. And how we do that, feedback and remedials, which is important part now. It is listed also. Maybe as you go into CBE now, you will have that also. We have very well listed how the students go through this process. Remember that feedback discussions have to be properly aligned, not that this is a session on feedback and in common, or you have put the results on the notice board, that is a feedback. This is a famous model by our ex-president APJ Kalam, who is known as Missile Man. If you look again on that, And also right now you see the word over conflicts which are going on. Use of missiles is a lot. And many innovative missiles, they will hit the target, even if the target changes its position. So what we need to do is provide proper feedback so the students, so the learning target is achieved. For that, we need to actually identify their deterioration much earlier so that there's a time for remedial. Okay, many places, when they are detained, they say, okay, we were never told. 1 week to the exams only, or before 2 days before exam, they are detained. They are told you are not doing well. That is not correct, actually. So what we should do is we should alert the students about their present position multiple times throughout the year, reinforce the desired goal that this is your goal at the end of 1 year. And after that, don't leave it here. No, they need help. And you now need to provide that help, how to fill these gaps. That is very, very important. So during the course, now what we are doing in other courses is eligibility issues are looked into that. Student parents are informed much in advance. At 5th month, a letter goes to the students' parents who are likely to be detained. Okay, so still there are 6 months to the exams. Remedials are required, which are given. Still eligibility issues in spite of remedials, then we detain those students and they go for supplementary exams. And this is very well clear-cut written in the regulations now. There's no ifs and buts remembering now. But each step we try to strengthen our formative and internal assessment. That is important. And how we give the feedback. There are two methods. One is sandwich method right now on your screen. Remember, you have to identify the areas of improvement and don't give it a bland. Okay, so now you need to add some actionable tips too, below and above. Not too much of sugar coating, but that in between those layers, you are giving the actual areas for improvement. That is known as sandwich method. You might have used this knowingly or unknowingly. Another is pendental model, which is ask the learner what they thought was good. Let them first tell, and then you add to that. Tell the learner what you thought was good. You add on to that. Second cycle. Again, ask the learner what they would need to improve. First, ask them. Once they have told them, you add on to them. Mentor states how it could be improved. And in the last, you people will summarize, and there's a take-home message for each of the learner. That is Pendleton method. Both are very well-tested models. Based on the context, which type of feedback it is, university exam, class test, you can use them for those methods. We also had a new method we tried as a FAMER project last year, Ask, Tell, Us, in the pharmacology. We made for the full 1 year. People say how we can give feedback for full 1 year. There's no time. So that's what we devised. 2 months theory assessment. We have developed a rubric. Rubric is like this. We have a mix of MCQs. So we have a mix of these in the rubrics. 3 months internal assessment, they are asked and we sit down with them. We divide the class into between teachers. It is not that everyone has to talk to HOD. All the teachers are divided. 4th month is practical assessment. We use a rubric. Then 5th month is theory. And like that, we have devised and we have done. It was doable and feasible. This was the rubric which we developed for that. Now I would like to show you like when you have a various plants and what's any plant there from there? Yellow. So we think of our learners as plants. Okay. So you see in the plants, you see a lot of things. Leaves are there, flowers are there. One fine day, you want to know whether this plant is growing well or not. You take out the plant from the roots, out of the pot, observe the roots, and you think there's some problem or not, you again replant. Do you think this way, if we do, remember that we do many times with the students, that you don't do this, you don't do that. We go to that person, become too judgmental. But if you take the plant with the roots out of the pot, replant it again just to see those, whether it's doing well or not, it will create a lot of issues. Replanting or rerooting might lead to death of the plant. There are many indirect signs which you can see on the leaves, on the branches. Just looking at the pot will give you some idea. Color of the plant will give you an idea. So these indirect parameters which are there or surrogate markers which are there, you need to observe to look into that. That's what we call is a garden analogy. For example, the yellow one in the pot. So, for example, when you look at various examples, so why we do this? They say remediation is like a rain, should be gentle enough to nourish a man's growth without destroying his roots. Many times you call the students, they come and sit with you, you are very concerned, you give a lot of feedback. But remember, but if you have not talked to them before, your feedback might be like excessive watering of the plant, which will again damage the plant. So it's very important that you first identify the needs. Then you see whether this plant needs a water or this want to withhold the water for few days. Or maybe you need some fertilizers only, or maybe sunlight is missing, or even that is there, you just need to do some trimming only. Okay. So for example, when you look at this plant, assume this is one student. Remember, you are seeing it virtually on your screen. It's like external examiner taking examinations. And sometimes you have done in the COVID, sitting online exams. But you see student like this only. But looking at this, what do you think this plant needs? I'm comparing this plants to a student and you are expert teacher or assessor today. By looking at this, what do you think this plant needs for the nourishment? You can keep on typing in the chat. You can have a look at that plant. I think you are able to see it. What it needs. Sunlight, okay. Yes, looks like some leaves are dull. What else? Water, okay. Water, sunlight, manure, okay. These are few things people, most of us will think about that. But remember, in the assessment, we assume a lot and we become judgmental. Like by observing this plant from a distance, you are able to give a decision. Okay. But remember, if this was my own student, I am closer to the student, I can touch actually leave, not physically touch the students, that can create problems, right? You can touch that, leaves lot of dust on this. And when we are talking about water and all, it is an artificial plant. So means water and all will not help. Maybe just clean the leaves with the water will help that. It's very important. Go closer to the students. See what is their need and give them that feedback only. These students, these are Gen Z. Okay, they are very prone to not taking or listening to you if it is a irrelevant feedback. So this is the water analogy, what we see, we need to do it. Observations, yes, definitely. But as external examination, we hardly get 3 minutes or 4 minutes with a student. So best is internal assessment, where we get one full year. But reflect onto yourself. Just think about for 10 seconds, how many minutes you spent with a single student in the last 1 year. Okay, so we need to invest time in that. Remember, postgraduate students also has a format now. They complain a lot of things happen. Okay, the guides will say that, student will say that. So now there are proper guidelines that postgraduate should have assessment, internal assessment. There's a format also. Quarterly, we need to send it to principal office. I think as you are sending to competency-based education, you can think about that. So in nutshell, to strengthen internal assessment, each subject need to internalize concept of internal assessment, use standard methods for internal assessment. Many are available. These formats are available. Dr. Ritu will share with you. Universities can frame guidelines. Each faculty need to invest more time in internal assessment and more resources too. So thank you so much. If we have some questions, we can take. We'll just see. Anybody raises hand or in the chat something coming up. We'll share this article also of internal assessment and the format also with you. Yeah, thank you so much. We'll go for the next component. Right.
Okay. Sorry for the technical glitches before. We have figured it out, but I'll go with the theory part first and then we'll show the videos to you again. So we've already discussed TOPS. Now we come to logbooks. So logbooks is basically a compilation of cases. It could involve a complete history, physical examination, diagnosis, and the treatment record of a patient. Most of you would be saying that logbooks we already are using. Yes, we are definitely using. But what is important is that are we providing feedback also to students or not? So logbooks would have relevance only when a proper feedback to the students on their progress is also being given. Then there is something known as clinical encounter cards. These are small readable cards like an instruction booklet, where a student makes an entry in the card every time there is an encounter with a patient. At the end of the rotation, a list of cases seen by the student is generated. It is reviewed by the assessor and a feedback is provided. The usefulness of this is it gives the trainer a good idea of spectrum of clinical work exposure. Prompt, specific, timely, and clinically relevant feedback can be given. The only problem with this is trainee is not directly observed, so validity of interpretations based on them may be limited. Coming on to case-based discussions. Now, case-based discussions are different from the traditional case presentation. Case presentation is that a patient has come on the dental chair and the student has started taking case history, and now he formulates the prognosis, the diagnosis, the treatment plan, and presents a case. But a case-based discussion is more like a mortality meet, where already things have been done and now the students will be discussing. So how can that be done? For example, they take out the file of a patient who has been treated, the procedure is complete. So now they would discuss the history, the treatment that was done, and they will present it. So case presentation is more of a hypothetical situation, whereas case-based discussion would be on what actually had happened and how the case was taken care of. This evaluates the clinical reasoning of trainees so as to understand the rationale behind the decisions made in an authentic clinical practice. This is one format of case-based discussion where these are the areas where you're going to grade the student: medical record keeping, clinical assessment, investigations, treatment. And then you give a feedback the way we are talking today. Anything that was good, suggestions for development, an agreed action plan. This is another example of a case-based discussion record form. Next is multi-source feedback. So feedback, there are various forms of feedback and various ways and where you can take feedback. Multi-source feedback, also known as 360-degree feedback, where you use multiple people who can provide feedback to the student. They could be the teachers, their peers, the patients themselves, the paramedical staff. So it is a systemic collection of performance data and feedback for an individual trainee using structured questionnaires. Structured questionnaires are provided to all the people who are going to provide feedback. And the reliability increases because the number of people who are providing the feedback, they increase. So student gets a clear idea of his or her performance. Feedback allows the trainee to reflect on his behavior. It gives opportunity to give suggestions, allows to identify the learning needs and identify those who need support. Next is portfolios. Portfolios are a tool for collecting and presenting evidence of learning at various levels of training. They may contain listing of clinical material seen, reflection of those experiences, and past performances on workplace-based assessment tools. Now, portfolios have become very important in competency-based education, where the students, they create their own portfolios, and a reflection sheet is also added where they reflect upon their experiences, and they can do reflective writing in a different way and present it in their portfolio. So portfolio is to measure the reflected ability of the candidate, to collate assessment for information from various sources. It can be used for self-evaluation and reflection, and can be used both for formative and summative evaluation. And it also leads to documentation of their work. It is used in an archive as well as a place to do analysis of the outcome. These are the various online tools where you can create your e-portfolio. Like Google Sites, we have tried hands on that. It is very easy, very simple. You can always try it for yourself also. It's interesting, and you can create your e-portfolios. Now coming on to mini clinical evaluation exercise. So what is a mini clinical evaluation exercise? It is a formative assessment tool. It provides feedback on skills essential to good medical care. And you observe on an actual clinical encounter. So how is it different from DOPS? DOPS is based on a procedural skill, whereas mini CX is based on a clinical encounter. This short episode of real student to patient interaction. It is observed and judged using a standard rating form, and it is followed by a constructive feedback. How to do mini CX? One encounter takes 20 minutes and has 2 steps. Examination, 10 to 15 minutes, and feedback, 5 minutes. What all can be demonstrated? Dental interviewing skills, physical examination skills, professionalism, clinical judgment, counseling skills, organization and efficiency of a student, and overall clinical competence. At the same time, if there is shortage of time, it is not necessary that all these skills are examined at the same time. You can mention that today you're going to be evaluated for these all skills, and maybe some other time for on another patient, they can be examined for other skills. This is a characteristic mini clinical evaluation exercise form where we have all these skills, and you can actually mention whether it is observed or not observed, and you can give your ratings. Then in the end, it is followed by comments from the assessor. Before coming on to the videos, I would now like to discuss the key issues in the implementation of WPBA. So in your chat box, can you tell me today, whatever we have discussed, what are the various challenges that you can face while implementing workplace-based assessment? In the chat box, please. It's time consuming, yes. Teacher to student ratio, yes, you need facilitators. Logistical, as in what else do you require for logistical? Can you elaborate? More manpower, okay. Basically, more number of faculty, you are saying, all right. Infrastructural issues, I don't think we need an infrastructural issue for a workplace-based assessment, because you already, the student is conducting the procedure. The only thing is that you have to observe it. So infrastructural issues won't be there. I can understand the problem with the faculty-student ratio, and it's time-consuming. lack of experience. Very good. So what are the solutions for it? If you want to incorporate workplace-based assessment, normally in your clinical setting, what all would you like to? How do you want to solve these problems? So basically, the first thing that is important is, yes, very nice. It is that the faculty needs to be sensitized and trained. So you all have taken the very first step of the sensitization and training. Congratulations to all of you. So the faculty needs to be sensitized and trained. Coming on to the time. So what we did in our department was students come for clinical posting at least twice in a year. Okay, so what we used to do, we used to do DOPS at the beginning of the posting and in the end. So it was around 4 DOPS for one student at the end of one year. At least this much is possible. And once the faculty is sensitized, so you can use different faculty for different encounters. So I'm giving you an example of DOPS. If in case there is another department or you want to do it for your clinical skill, then many clinical evaluation exercise can also be there. Mindset and approach, yes, with the NDC coming, the mindset and approach will definitely change once it becomes mandatory. So definitely we need to move forward with those changes. All these changes we feel whenever there's a change brought out, there is a little bit of resistance, but once it becomes mandatory, then we all have to go through that process. So it is time consuming, but if you make it a habit that in the clinical postings, one before in the beginning of the posting and one in the end, it is manageable. For 10 minutes, it is manageable, definitely. So the key issues, which you also have determined, sensitization of students as well as faculty training, feasibility, creating an environment of mutual trust. So what we have realized that once you give a constructive feedback, like Dr. Ritu had said, that you do not comment on their performance outside the clinical setting. You do not comment on that, on their appearance. The students also develop that kind of trust. And there is a definite improvement, and they will themselves come. All these exercises, the key point of them is that the student comes to the assessor that I want this procedure to be done. So it comes from the student. So creating an environment of mutual trust is very, very important. And include in the regulations as an NDC is coming. So definitely we think it's going to be mandatory for all. So we conclude by saying that regular assessment with multiple assessors, unique scenarios at each assessment, and prompt feedback can maximize the benefits of workplace-based assessment. So with this, I will share a video first of Mini CX with you.
Yes, ma'am. Ma'am, can we do a mini clinical evaluation test today? Basically, I have a patient.
Okay, you arrange for that. So for today, I'll evaluate you for your history taking skills, physical examination skills, and communication skills.
Okay, ma'am.
So arrange.
Yes, ma'am. Thank you. हाँ जी सर, क्या दिक्कत आ रही है आपको?
मैम मेरे कुछ टाइम से ना मेरे मुंह में छाला बन गया है और कुछ खाया नहीं जा रहा। ठीक है मैम, और जलन सी पड़ती है।
जलन पड़ती है। कितने टाइम से ये आपको?
ये लगभग 2-3 महीने से।
2-3 महीने से। ठीक है। और आप कोई बीपी, शुगर, थायराइड कुछ लेते हैं दवा वैसे?
नहीं मैम, ऐसी कोई नहीं।
ठीक है, एक बार मैं चेक कर लेती हूँ। ठीक है, मुंह बंद कर लीजिए, नीचे कीजिए थोड़ा सा, इस साइड कीजिए, तो इस मेरी तरफ कीजिए, उस तरफ कीजिए, आगे आगे नीचे कीजिए। ठीक है। आप कोई तंबाकू वगैरह या सिगरेट स्मोकिंग करते हैं?
नहीं मैम, ऐसा कुछ नहीं है।
देखिए, आपके जो छाला जख्म हुआ है उसको देखकर ऐसा लगता है कि आप तंबाकू या स्मोकिंग वगैरह कुछ करते हैं। इवन आपके दांतों पर भी जो स्टेन्स लगे हैं उसको देखकर ऐसा लग रहा है मुझे कि आप स्मोकिंग तो करते हैं। साथ ही में जर्दा, पान जो भी आप लेते हैं आप बता सकते हैं मुझे?
कभी कभी मैम।
और कितनी देर से आप ये ले रहे हैं?
मैम काफी समय से ले रहा हूँ।
सिगरेट के कितने, मतलब आप एक दिन में लेते हैं सिगरेट्स?
मैम 2 से 3 सिगरेट।
2 से 3। और जर्दा के पैकेट?
जर्दा 5 से 7 पैकेट।
बहुत ज्यादा है वैसे। पर देखिए, आपके इस छाले की जांच के लिए हमें छोटा सा मांस का टुकड़ा इस छाले का लेना पड़ेगा, उसको लैब में भेजेंगे और फिर पता चलेगा। अभी तो मुझे देखकर कैंसर की शिकायत लग रही है।
कैंसर?
हाँ, मुझे लग रही है देखने पे। हो सकता है कि कैंसर हो सकता है ना भी हो, ये लैब की जांच के बाद ही पता चलेगा। लेकिन आपको ये स्मोकिंग और जर्दा ये छोड़ना पड़ेगा। आपने उस पैकेट पे भी देखा है कितना लिखा होता है उस पे कि ये स्मोकिंग किल्स और ये इससे मतलब कैंसर होता है। तो आप फिर उस बात का ध्यान रखिए। आगे के लिए आपको स्मोकिंग नहीं करनी है। आप तक का ही आप ये परहेज करिए ताकि ये और ज्यादा खराब ना हो जाए।
ठीक है मैम, मैं आज से इसको
हाँ, और आपको बाकी मांस का भी टुकड़ा लेंगे, उसके बाद जांच के लिए भेजेंगे। ठीक है?
Okay, Kushmeet. So it was a good clinical exposure. You tell me now first, what do you think went well, and what do you think could have been better?
Ma'am, I took the history well, and I did the examination as well, and counseled the patient. Though the patient was a bit hesitant in the initial times, but I elicited the history well. The patient was able to tell me later on his habits, the frequency and duration of whatever he was taking.
Anything you think that is not correct, which could have been improved?
Ma'am, I was not able to perform the examination well. The lymph node palpation, I was not able to perform it well, and also I forgot to wear the gloves.
Yes. So yes, you took a very good history from the patient, but like when you were taking the history, okay, you asked about the ulcer. Okay, you could have asked now whether the ulcer was painless or whether it was painful, whether there was any previous exposure of anything which could have lead to the ulcer. Okay, and whether there was any bleeding from the ulcer, any recent increase in the size of the ulcer, okay, any growth associated. And also you should have asked patient that whether there was any previous history, like 1 year before, 5 years before, of ulcer, like same ulcer which healed on its own. Okay, something like that. And you asked about the past medical history.
Yes, ma'am.
Okay, but you forgot to take the past dental history. Okay, so whenever we have a patient like this, it's very important to ask about any like sharp tooth which could be source of trauma. Okay, to rule out traumatic ulcer or any other form of the ulcer. So, or any traumatic exposure, any other like brushing or any other source of trauma. So you should have asked about that. And also any drug history that could have been asked about it. And examination, yes, you did very well, but your positioning was wrong. You should have stood behind the patient, so it would have been easy to palpate your submanubrial lymph nodes and other neck nodes also in a better way. So take care of that in future. And yes, the blunder was not wearing the gloves. So you knew that. And yes, patient counseling was also done in a very good way. You develop a good rapport with the patient, but we should not break the news like you could have cancer. You saw the reaction of the patient. So you could have told him that you are taking tobacco, so these could be the consequences, and one of that could be the cancer. It is not like he's having a cancer, and you advised him biopsy, which is actually mandatory. But just to pacify him, we could actually suggest a very simple non-invasive test like exfoliative cytology. And yes, you mentioned about you advised him to quit the habits as soon as possible. And you should have asked actually anyone else has come with him, so that that person also could be counseled or could be told about his condition, so that we can decide the future course of action. And biopsy, you could have advised him to go for the biopsy as soon as possible, or at least for the exfoliative cytology. Cytology smear we could have taken today. Okay, so whenever a patient like this comes, always go for the screening first. Okay, and next day we can go for the biopsy once the patient is prepared or as per the patient agrees.
Thank you, ma'am.
I'll be sharing the DOPS also video.
Hey, come in, ma'am. Good morning, ma'am. Good morning. Come sit. Thank you so much. I have a patient for screening today. So I want to go to screening, and I just wanted to take drops soon. Have you done drops before? Yes, once I have done. Where? Which department? In both surgery for extraction. Not in this department? No. Okay, so this is your first drops in there? Yes, ma'am. Okay. So you want to be scaling for which quadrant? Lower anterior squatting first. Okay. What is the diagnosis of the patient? It is chronic generalized gingivitis. So why do you think scaling is indicated for this patient? Actually, patients have deposits on the surface and on gingival margins also, and calculus and scaling are deposited there. So that's why you want to. So what all instruments do you think you will?
Screen sharing is first.
Problem with the video, ma'am.
ठीक है.
Got it. Wait, video for you.
ठीक है, आज आपका मैंने नीचे वाले काम कर दिया, आगे वाले ठीक है, बाकी काम कल करेंगे.
Okay, Mohit, now you take that and come to my chamber. Think how it will be lost. I'll give you a reflection sheet first. Think about that and then you can come to this.
Okay, thank you so much, ma'am. good with finger rest positioning, I think, and my chair positioning was also wrong somewhere.
Yes. Being tall is a benefit also, but at the same time, you need to be very careful of your chair position. So your patient should be lying in your lap, okay, so that you can, with your fingers to you, so and you have to adjust your illumination accordingly.
Okay.
All right. And your finger rest, which finger to use for your finger rest?
The middle finger.
Yeah, so it should be middle. No, it should not be the middle. Middle finger is basically for modified therapy. So it should be either your ring finger or your little finger. So because versus scalar, your finger rest was proper. But when you were doing your scaling with the small fingers, that time you did not you forgot to place your finger rest. So that is one thing which you can improve on. Okay, so you mentioned that from your previous procedure, this was a better job. Okay, fine. So now we go stepwise and discuss what all happened. Okay, so considering your knowledge about the procedure, so I think you read about it, but you need to improve, you need to put your knowledge into your technical ability also. So you need to improve on your finger rest, your adaptation, that was no problem. One more thing that I noticed was, see, sterilization was good, but it is always better to put the cotton rolls inside the vestibule so that you keep cleaning the instrument. So I was observing that you were using the instrument and then you were using your other hand and taking off the cotton. So that is inconvenient for the operator also. Okay? And you don't need to put a soil instrument back on the tray. Okay? So when you're putting the isolation cotton rolls in the vestibule, you're doing isolation also and it is also helping you to clean your instrument side by side. Is that clear? Then visibility, finger rest, that you need to improve. Communication with the patient. So initially you greeted the patient very well, that is very nice, you made him feel comfortable. But if you remember when you were changing the chair position, you did not inform the patient.
Yes.
Okay. So sometimes we listen to the patient, sometimes the patient might not be ready, and a sudden movement can cause unnecessary apprehension. Okay, so you need to inform the patient while you are changing the chair position. Alright. So at the same time, there was one point when the patient felt slight pain in his gums and he said, right? So you quickly corrected your position. That is okay. But you need to comfort the patient also. You need to tell them, or you need to say, okay, sorry, ज़्यादा दर्द नहीं हुआ, आप ठीक हो, ये हो. Okay, so you need to talk to the patient. If you do not talk to the patient, that apprehension will keep on increasing. Alright, so the communication part you need to improve. So basically we are doing jobs so that overall your performance, we don't need only to see whether you know scaling or not, whether you can interact with the patient. So the proper clinical setting, right? So here you need to talk to the patient, you need to make him comfortable. So your communication skills need to be improved. Organizational skills. Okay, so your instruments were arranged very properly, you went stepwise, but in the end it was like as if you were very happy that the procedure has ended, so you quickly kept the instruments on the tray haphazardly. So that should not be done. Okay, hardly takes 2 minutes, needs to be kept clearly. Okay, so I would suggest that to improve your finger rest, you need to read more books. So there are few hygienist books that are available in the library. I'm going to write down the names. Go see images with those and imagine before you come and do a patient. Imagine what would be the quadrant, what would be the chair position, light position, what would be your own position. See when you're doing mandible, so the patient mandible should be at your elbow level. Okay. One more thing that I noticed that you were basically doing your wrist movement. It should be an elbow movement. Okay. So these things you need to keep on improving. So it is better that you do more of talks and with other faculty also. Because when other faculty are trying to observe you, they can do better things. Okay? So that's my feedback. So let's identify the areas of improvement. So what do you think we should be doing?
My communication skills first of all with the patient.
So we can see more of videos, alright? You can see online videos and you can improve your communication. Okay. Then adaptation of instruments, as I suggested. Okay, so there is a hygienist book known as Toolkit. You can go through it, see images, and try and understand those, and you can improve on those. Okay, and I would say that we do more of talk with other faculty. And for other procedures, like today we did for scaling, you do it for case history, you can do it for communication with the patient, by getting into oral hygiene instruction. Alright? Overall, it was a good performance, but we try and keep improving on trauma. Okay? So, thanks.
Okay. So we had to compress the video and bring it online. So probably the voice quality went down with that. Sorry for that. But yes, we are also learning every day. So any comments or queries? Hope with these videos, a little bit of clarity for those who have not tried mini CX and drops. Now you would have a little bit of clarity as to how to go about these workplace-based assessment tools. Any comments? Does the involvement of parent during the history requires any suggestions? In case you have a pediatric patient and you're talking to the parent, then definitely yes. The parent would be the first a point of contact. So then if you're assessing the student on the communication skills, then definitely yes. Anything else? In terms of feedback to the students, yes. It would see like in mini CX also, if you could hear the feedback was given that it is always when you're breaking bad news or you're explaining a few instructions which you think that the parent would understand more, or if you're breaking bad news, it is always mandatory. It is a part of feedback that you try and do it in a presence of a family member. So then definitely, yes, the students need to be given this feedback that they have to involve the relative. I hope I answer your query, Dr. Ankit. Thank you. Anything else? So we have shared a feedback form with Dr. Virendra Goyal sir, and we would like to have your feedback about Module 1. So the prompt, the feedback, the better are the things that you will be able to write to us, and let it be an honest feedback so that we can also improve ourselves for the next time. Thank you all. Kindly provide feedback to us. Thank you. Virendra Goyal sir, may I request you, sir, I have sent you the feedback on your WhatsApp, sir, if you could put it in the group.
Okay. Dr. Anushi, I have the feedback form,
Yes, sir.
but I'm wondering that how we can share it. Maybe we can share the link in the chat box.
Okay, sir, we'll do that.
I think that will be better because the data which I have may be different from the attendees who have joined, they will be joining later on. So it's better that we can share the link and everyone can just click that and share the feedback. That will be better.
Yes, sir. So we have shared it already, but if you could copy it, everyone, please, right now, so that, or open it up at least, because it might be disappearing once the meeting is ended. So if you could,
Yeah,
we'll give you 5 minutes.
Yeah, and Dr. Anushi, we can keep this feedback form open. Maybe we can get the feedback from others also later or something like that, because I have uploaded the video and I will be uploading the video on the YouTube also and sharing the link with everyone. So I will upload the link of that feedback form in that video also, so that they can also give you feedback, right? I will do that.
Thank you so much. Thank you so much, sir.
Yeah.
And
Yeah.
to all the participants, if we are there for 5 minutes, if you could please click on it and save the link. Thank you all. And we
And we
meet
can ask
for
the
the
participants if they are able to open the Google form or no.
done. Okay. Thank you, Dr. Amina. And we'll see you next on 13th for the module 2, same time.
Thank you, ma'am. I thank all the speakers. It was a very successful session for the past 3 days, and we'll join in the next week from the 13th of May to the 15th from 3 p.m. onwards.
Thank you so much.
Thank you, ma'am.
Much.
And we
Thank
are
you,
just
Dr. Thank you, Dr. Ritu, and of course, big thanks to Dinesh Boreal and Dr. Shashi and Dr. Shashi, your team, Neha, everyone, for carrying this program so successfully. We are really happy that we did this for the first time, online program for all the faculty members of ISPPD. And see you next week, 13th at 3 p.m. for another brainstorming 3 days. Thank you.
Thank you so much.
Thank you, sir.
Thank you. Thanks a lot. Take care.
Thank you, sir.
Thank you. Thank you. Thank you, everyone, for your feedback. We are receiving it.
Yeah.
Thank you.
Bye-bye.